Because there are myths in dentistry that explain why we have dental problems. The number one is you don't brush enough, but I see patients that really brush very well and still have problems. And the reason why not brushing enough is because the plaque growth is so extensive when you don't have enough minerals that it's impossible to keep it really, really clean. And then you still cannot stop the demineralization because it's something that the body really needs. But that's hard to grasp because you learn in dental school and in the school for dental hygienists, brushing is key. And the other thing is fluoride. Fluoride would strengthen the enamel, and then when the enamel is very hard, you don't get cavities. But I also think that's not true, because cavities don't start in the enamel. They start in the dentin. So it doesn't matter how strong the street is. When you take the sand below it, you will get a cavity. The only problem with that very hard enamel is that the detection is not so easy because the enamel doesn't break soon enough. So now you have a big cavity on the hard enamel and you couldn't see it. Of course, we have X-rays then, and if you take them regularly, you can see the minor cavities already developing, and that's the reason why dentists need to take X-rays. Otherwise, sometimes the cavities are really well hidden by the enamel. And then sugar. That people say sugar causes cavities. But it's not the sugar that causes the cavities, but the sugar acts as a drug. It eradicates vitamins. And what's very necessary for absorption of the calcium and the magnesium is the vitamin D3 and vitamin K2. So if you take sugar or refined carbohydrates, and that's the rice without the shell and the germ into it, then carbohydrates are like sugar. And it's addictive. You're always on a low energy level because the carbohydrates and the sugar only produce 1/6 of the amount of energy that the mitochondria could produce when they have fats or proteins. So my conclusion is that we should get rid of the myths and start looking at why people have dental problems. And what I discovered in the last 13 years is that with remineralisation, you can restore and solve this problem. And I made a package. These are 3 products. 1, the minerals in the middle, vitamin C, and 3 oils. I call it the remineralisation package because it helps remineralize the teeth and the bone around the teeth. It helps the inflammation. So this is what I discovered in the last 13 years, and I've been able to use the products in the last 10 years with incredible success. I couldn't believe my eyes that it really worked that well. So it sounds crazy, but the need for extensive brushing, extensive flossing, or using toothpicks or interdental brushes is way less important than using these remineralization factors. I discovered that the growth of bacteria in the mouth is 20-fold higher when you don't have enough minerals